Here is a comprehensive and detailed guide on vasopressin. 1. Generic name, drug class, drug forms, 1. Brand name. Generic name, vasopressin. Drug class, endocrine classification, antidiuretic hormone. Cardiovascular classification, vasopressor. Drug forms, injectable solution available in ampules or vials for IV, IM, or SC use. Typical concentration, 20 units per milliliter. Brand names, Vasostrict, IFOI formulation used for vasodilatory shock. Potressin, older formulation, discontinued in some markets. Compounded pharmacy formulations may be available for diabetes insipidus. Stop. Definition. Vasopressin is a synthetic version of the naturally occurring antidiuretic hormone, ADH, produced by the posterior pituitary gland. It plays a critical role in regulating the body's retention of water and vascular tone. Therapeutically, vasopressin is used to treat hypotension, diabetes insipidus, and variceal bleeding, and to support cardiac arrest protocols. HAPASH-3 mechanism of action. Vasopressin acts on 3 main receptor types. V1 receptors, vascular smooth muscle, causes vasoconstriction, which increases systemic vascular resistance, and blood pressure. Also affects liver, uterus, and platelets. V2 receptors, renal collecting ducts, promotes reabsorption of water from renal tubules back into the bloodstream, concentrates urine and reduces urine output. V3-V1b receptors, anterior pituitary, involved in ACTH release, indirectly modulating stress response and cortisol levels. 4. Indications. Septic shock, vasodilatory shock, used when fluid and catecholamines, e.g. norepinephrine, are not effective in maintaining blood pressure. Gastrointestinal bleeding, especially esophageal varices, reduces splanchnic blood flow. Central diabetes insipidus helps manage symptoms by reducing excessive urination and water loss. Cardiac arrest, off-label, as a substitute or adjunct to epinephrine in ACLS protocols, less commonly used today. Vasodilatory shock following cardiopulmonary bypass or anesthesia. 5. Contraindications. Hypersensitivity to vasopressin or its components. Chronic nephritis with nitrogen retention in diabetes insipidus treatment. Coronary artery disease or recent myocardial infarction can exacerbate ischemia. Advanced renal failure. Pregnancy category C, use only if benefits outweigh risks. 6. Before taking this medicine, precautions. Before receiving vasopressin, tell your doctor if you have heart conditions, arrhythmias, hypertension, seizure disorders, migraine, asthma or chronic lung disease, kidney or liver disease, low sodium levels, hyponatremia. Pregnancy, use only if clearly needed. Breastfeeding, unknown if excreted in breast milk, use caution. Monitoring, continuous monitoring of vital signs, electrolytes, and urine output is essential. How to use. Administered only by a healthcare professional in a hospital or critical care setting. Routes, intravenous, IV infusion, intramuscular IM, or subcutaneous SC, depending on indication. Do not self-administer unless specifically trained and directed for long-term management, rare. Administration tips. For IV infusion, always dilute in normal saline, not dextrose solutions. Must be administered through a central venous catheter when used in continuous infusion for shock. Use infusion pump to control the rate precisely. 8. Dosing information. A. Vasodilatory shock, e.g. septic shock, IV infusion, start 0.1 units min, titrate to 0.304 units min. Avoid exceeding 0.04 units min due to risk of ischemia. B. Esophageal variceal bleeding. Bolus, 0.2 to 0.4 units min for 30 minutes, followed by maintenance, 0.1 to 0.2 units min for several hours. C. Central diabetes insipidus, 5 to 10 units 2 to 4 times per day as needed. D. Cardiac arrest, off-label, per older ACLS protocols. IV push, 40 units once, replacing the first or second dose of epinephrine. Note, epinephrine is now preferred in updated ACLS guidelines. Miss a dose, overdose. Miss dose. In hospital use, unlikely. If used at home, rare. Take as soon as remembered, or skip if close to next dose, never double up. Overdose symptoms. Severe hypertension, hyponatremia, water intoxication, confusion, seizures. Bradycardia, myocardial ischemia or infarction, abdominal cramps, nausea, vasoconstriction-induced tissue ischemia, limb mesenteric cardiac. Treatment: stop vasopressin immediately, provide supportive care, correct electrolyte imbalances, consider vasodilators or volume expansion. Hack 10. When to stop or avoid taking. Stop or avoid vasopressin if you develop signs of angina or heart attack, chest pain, ECG changes, symptoms of water intoxication, headache, confusion, seizures, severe hyponatremia, evidence of ischemic complications, cold extremities, pallor, allergic reaction, rash, swelling, difficulty breathing. 11. Side effects in detail. A. Common side effects: headache, abdominal cramps, nausea, sweating, tremors, pallor. B. Serious side effects: hyponatremia and water intoxication, confusion, drowsiness, seizures, coma, cardiovascular effects, bradycardia, myocardial ischemia or infarction, arrhythmias, hypertension, peripheral and digital ischemia, tissue necrosis or gangrene, pulmonary effects, bronchospasm, caution in asthma, COPD, skin necrosis at the injection site, especially with extravasation. 12. Vital information. Vital signs, BPHR, and serum sodium must be monitored regularly. ECG monitoring recommended in shock or cardiac use. Urine output is a key parameter for effectiveness in shock. Use central venous access to avoid tissue necrosis. Do not exceed 0.04 units per min for vasopressor use. Avoid mixing with dextrose-containing solutions. Use caution with other vasopressors due to additive vasoconstriction. Hash 13. Other drugs that will affect vasopressin. Increased effects, risk of hyponatremia, NS, reduce renal blood flow, enhance antidiuretic effect, carbamazepine and chlorpropamide increase sensitivity to ADH, SSRIs, risk of PSI-ADH and hyponatremia, TCAs, tricyclic antidepressants, vincristine. Decreased effects. Lithium reduces vasopressin response at kidneys, norepinephrine, dopamine, ergot alkaloids, triptan's important. Always inform your provider about all medications, including herbal and OTC products. Catecholamines. Thank you. Have a nice day.